André Fortin is a Liberal critic, and by the way, that interview with Aaron will come up just after 3 o'clock. So André Fortin, as I mentioned, is the Liberal health critic. He is on the line because we've been talking a lot about Bill 15 in recent days. I know the Liberals have in the National Assembly gotten up, demanded some answers, or tried to get some idea of what exactly is in this massive overwrite of the existing healthcare bill as we have it now. André Fortin is on the line. André, thanks for being here.
Good afternoon.
By the way, how did you vote on Christmas and Santa Claus yesterday? Did you vote for?
It's hard to vote against it,
yeah.
But it's one of those things where you see the government applauding themselves, patting themselves on the back, and say, "Okay, well, are we dealing with the stuff that people expect us to deal with?"
Yeah, so we can still say it's Christmas. That's fine.
Exactly.
Let's talk first of all. Let's talk about an overview of Bill 15. We keep hearing. I know there was a meeting last week actually in Montreal over Dawson College. Jennifer Macaron was involved in that, looking at some of the aspects of this massive override of the health bill and how it will affect Anglos. But beyond that, let me first start off with the subject at hand, which is the fact that we are seeing massive overcrowding, not just in 1 or 2 hospitals. I think Aaron's article listed 5 separate hospitals in Montreal that are now over 200% capacity. So what are you asking of the government to do? How does this get changed? Or is this simply a matter of them saying, well, it's that time of the year?
So that's the health minister's line. He had 2 lines this week. One is, it's that time of the year. The other one is, well, the strike's really affecting us. Well, the problem is he said that this week, and there's no strike this week. So sure, you may have a few people left over from last week in our emergency rooms, but that's not the overarching factor here. The real issue is we don't have enough staff in our emergency rooms. We don't have enough staff in our hospitals to take people away from the emergency rooms and put them into either long-term beds or hospitalization. And that's why you're seeing people spend 48, 50 hours. I think it was 53 yesterday at the Royal Vic, 53 hours on a stretcher at the emergency room. It's not because those people need to be in the ER. It's because they have nowhere else to go. So it's really a staffing issue. And so on a certain level, maybe it does come back to the negotiations that are going on with government right now and not having proper working conditions for our healthcare staff and therefore not having enough of them.
I also can't help but wonder whatever happened to the crisis cells that were supposed to be put in place. Has Dubé had anything to say about that?
So they put them in place last year, about this time of year, where similar problems, though not quite to the extent that we're seeing now, were happening. And so the government created, you're right, this crisis cell of healthcare professionals and experts to advise them on what they can do. Last week, the crisis cell, or one of the leaders of the crisis cell, came out and said, well, we gave our ideas last year. They put it in place in some hospitals, but we haven't heard anything since. It's basically just back to management being management and making all the decisions, and we're still here. Now, the problem that they're having, which is new this year, is they are seeing more and more patients, and not just you and me not feeling well and having a stomach bug or having a mild condition leaving the ER. They're seeing patients that they call priority 2 and priority 3. So people who have serious health issues are leaving the ER without ever seeing anybody. And if they're going to the ER, it's probably because they don't have a frontline access to a family doctor or anybody like that. So that's the really, really worrisome issue about what's going on this year is less people are showing up to the ER, but still there are more and more people spending more and more time there.
So we know, as you're outlining what the problems are, we know that they exist. The question then becomes, where's the solution here? Because if it's simply a matter of saying, well, we should be hiring more nurses, more people to work in hospitals, that takes money. The government doesn't seem to be in any kind of mood right now to pay any more money to get this done. So are we at an impasse here?
Well, there's other things other than money that government can put forward. They're not staffing their positions right now. There's a bunch of open positions that are allocated for, that funds are allocated for, that simply aren't being staffed. And they're not being staffed because people are, in some parts of the province, leaving the healthcare system altogether because of the working conditions. So one of the things we did propose is to say, can we improve the ratios of nurse to patient, of orderly to patient, and other jurisdictions have done this. And this is also, I think it's the number one issue that the nurses union is asking for. Everybody realizes it's not a short-term fix, but over time, if you put these ratios in place, people expect you to have better working conditions and become more interested in the profession. That's the problem that we're seeing now is people don't have confidence that if they go in the healthcare world, that they'll have the proper working conditions.
what were you going to say?
I was just, with respect to that, though, even if that were to change, I mean, that's a long-term solution, it seems to me, Andre, than dealing with what we have going on right now.
Yeah, it absolutely is. There are some short-term solutions. The crisis cell put in a few of them last year, and it did have an impact up to a certain point. They made sure that the long-term beds were open, whereas typically around Christmas and around the holiday season, they tend to close a few of them just because they don't have the proper staffing. So they reallocated some existing staff to places to take away from emergency rooms. The other thing that can be done is to have more frontline workers in long-term care facilities. The big problem with ERs, it's not people like you and me going in. It's people who end up spending hours and hours and hours there and who have no other option. So people leaving a long-term care going to the ER and who end up using a lot of the resources. So that's really the issue. Can we better address frontline in these places? I think it's something we can do with the existing resources and just figure out a way to allocate them better.
Yeah, that's kind of where I was headed. I was thinking about how everybody's focused on Bill 15 right now, and in the meantime, we're in crisis, and there doesn't seem to be any sort of sense of urgency. And I would expand it beyond just ERs. I mean, good God, the whole province is in crisis right now with the public sector strikes. We're in dire straits, and there doesn't seem to be any sense of urgency here, Andre.
No, there's really not. My kids are at school or are at home right now. And they want to go back to school. And we want them back in school. But you're right, there doesn't seem to be any sense of urgency. There was a meeting last night with the Treasury Board president and some of the unions, but they basically just said, okay, well, let's get back to the table. Why are they not in heavy negotiation right now? Why are they not constantly at the tables making offers back and forth? The last government offer really that we heard was 2 weeks ago, I think. The government still has this line of we're offering 14%. Whether or not you think that's right or true, that those numbers haven't moved in a couple of weeks.
Look, we could talk about this for a long time. I mentioned there was a meeting earlier in the week, and that had specifically to do with why Anglophones here should be concerned. So tell, if you could, maybe fill in some blanks. What in this bill as it stands right now, and again, it has not yet been passed, but the understanding it seems to be, the consensus is it's going to be pushed through. It's just a matter of days. What in here is the most concerning for Anglophones as far as you're concerned?
So I think there are things that are concerning for everybody. There's not a lot of positive impact to the healthcare network. This isn't a bill that's going to bring back people to the healthcare network. It's really just a governance reorg. The problem is that, and specifically for Anglophones, yesterday or 2 days ago, we started looking at the articles of the law that affect English-speaking Quebecers, and there's really two parts. There's the access committees, which, as you know, are in charge of making sure that there are proper plans outlined for how Anglophones can have access to the services they need, not just in Montreal, but across Quebec. What the government's now proposing is Santé Quebec will write these plans and will run them by those access committees. The problem with that is that really those plans need to come from users. They need to come from the access committees themselves and then be put in place by your healthcare establishments. In a region like mine, for example, having Santé Quebec in Quebec City, or even having the CEO of the Outaouais Healthcare Network, it seems pretty far away from our Charleville Hospital and the reality of what patients are living through there. So that's one thing that's a problem, and government seems intent on doing it that way. The big problem, however, is they introduced an amendment to their bill 2 days ago saying that putting in a mechanism to remove the bilingual status of some hospitals. And the way they wrote it, it basically says that Santé Quebec, the new board of Santé Quebec, can unilaterally decide that they no longer want bilingual status in hospitals if 50% of the population in the region isn't English, kind of the same way it was done with municipalities.
Right.
But there's no recourse. There's nobody to say, no, we're stopping this, we're blackballing it, we're vetoing it, we don't want it in our town. Municipalities had that option through Bill 96. There is nothing here to stop a government who's intent on removing bilingual status from doing so.
I'm going to leave it at that. First of all, we're out of time. And second of all, I'm kind of taken aback by the fact that they can actually just rubber stamp this should they choose to and decide to remove bilingual status. And if you decide you'd like to contest that, you just said that, there is no option to contest it.
They say they will consult the access committees, but again, they might as well just inform them. There is no mechanism by which they could say no.
Wow.
It's just we think you don't have 50% population, so the Jeffrey Hale Hospital in Quebec City, the Institut Gériatrie in Sherbrooke have bilingual status, but they don't have 50% population. That's the whole point, is people still have in other parts of the province still have to have access to services in English, and this would mean a government intent on removing it could absolutely do it. You've
brought this up. Is there any chance this can be taken back or somehow, lightened, whatever you want to call it?
It's suspended right now. I think to be honest, even the healthcare minister seemed surprised by what he was proposing, or maybe he's surprised by the fact that people actually took notice of it.
Yeah.
But so it's suspended. We'll see when he brings it back. But as it stands, that is what would be approved if government invokes closure and we don't get to debate it anymore.
Never a dull moment.
André Fortin, provincial Liberal health critic. André, it's always great to have you on. Thanks so much.
Thank you.
All right, chat soon.